Welcome to the Global Public Health Revolution, the podcast by the AIDS Healthcare Foundation, where global public health meets bold advocacy and game-changing marketing to spark real change. Welcome to another episode of the Global Public Health Revolution podcast. I'm excited about this episode because it centers the voices of young people in global health. It'll be the first part of a two-part episode that will put the spotlight on young people from Europe, Asia, Africa, and Latin America. This is a conversation you don't want to miss. In today's episode, we're handing the mic to young advocates from Ukraine and the Philippines, Viktoriia and Jullian, to hear directly from them about the challenges that young people face, the innovations they're pushing forward in global health, and their vision for a healthier and more inclusive future. Hi, Jullian. Hi, Viktoriia. Thank you for joining us on the Global Public Health Revolution podcast.
Hi, Kemi. It's an honor to be here.
It's an honor to have you. To have your voices is always very, very, very exciting and energizing. And Viktoriia, how are you?
Hello, everybody. I'm really excited for the conversation today.
Great. Okay, so typically we like to just get to know our guests a little bit. So let's start with you, Viktoriia. Can you tell us a bit about yourself? What inspired you to become a youth advocate? And how do you find the courage to be a voice for your peers?
My name is Viktoriia. I live in the Kyiv city, in the capital of Ukraine. And a little bit about me, I'm a high schooler in the Ukraine. And I'm really passionate about global problems and global participation. What inspired me to become a young advocate is seeing people around me and seeing how they transform when I make an impact. And this really pushes me forward. And my main inspiration is also people around me, because they are really kind in Ukraine and they are really inspiring to not to give up and to keep going and to keep making impact and keep pushing for a better future for our kids' next generation.
And just before I go to Jullian, so it's so lovely to hear you speak, Viktoriia, and I just want to salute your courage, because despite everything happening in Ukraine, it is inspiring to see you stand up for young people and to also draw strength from your community. So just know that we are with you and we just salute your courage, and to the rest of the young people who continue to do great work despite the challenges. All right, so let's go to Jullian.
Hello, everyone. So my name is Jullian Elena Pitumbali. So I'm from Metro Manila, Philippines. So I have been a youth advocate for almost 6 years. And let me tell you a story. And it all started back in year 2020, the year the pandemic started. So during that time, I joined a youth organization in our community that focused on empowerment and leadership. So, as someone who was shy, introverted, and just trying to find my footing, I was simply just testing the waters back then. So, I didn't know exactly what to do, but I was willing to learn. So, through various activities, seminars, and trainings, I slowly came out of my shell, thankfully. And I began gaining confidence, made friends, and met people who empowered me to become the best version of myself. So they saw something in me that I hadn't seen in myself yet. And that encouragement became the foundation of my advocacy. So, what truly inspired me to be a youth advocate was my exposure to the diverse communities we serve. So, through the organization, I was given the opportunity to interact and bond with my fellow youth from all walks of life, especially those from marginalized sectors. So, in those moments of connection, I saw something powerful: hope, resilience, and a deep passion for change. So, the people there, they weren't just looking for help. So they were looking for someone to represent them, to be their voice. And in time, I became their ate. So ate is like an older sister in
Okay.
Filipino. So I became their ate, I became their mentor and their friend. So whenever I had the opportunity, I passed on the learnings I gained from the seminars that I had attended.
Mm-hmm.
So I guided them, listened to them, and I was there when they needed support. So it's not an easy responsibility,
Mm.
but it's one of the most fulfilling roles I have ever had. So
Awesome. It's so great to hear you, Jullian and Viktoriia, share your story and what has inspired you to join or to become a voice for young people or to also be a youth advocate. So listeners, when I tell you that the future is here, it's not tomorrow, this is exactly what I mean. Okay, so now let's go into the discussion of global health, because most times when people talk about global health, it seems as if young people are usually at the background. You know, when we talk about global health, we think about things like health system strengthening. We think about, health financing. We think about the big technical words, and that's great. But we also a lot of times, don't remember that within the focus of global health or even public health, we need to also look at young people, because they are very key. So let's talk about the barriers that young people face in your communities and how are you trying to address those barriers? If I could start with you, Viktoriia.
In my opinion, from my experience, the main bias, like the main challenge that we face today is biases regarding mental health. So, of course, like because of the full scale war, a lot of people have bad mental health. And according to UNICEF, in 2022, approximately 10% of Ukrainian population was living with some degree of mental health conditions, and war worsened mental health conditions, affecting approximately 25% of the general population. As for today data, I think this percentage is higher than it was for the start of the research of the UNICEF. But to address the young people, nearly 61% of parents believe their children have signs of stress, such as poor sleep. And 24% of young people aged 14 to 24 believe their psychological state has worsened since the beginning of the war. And 11% of of young people believe they need psychological help. So, of course, mental health is a really, really pressing problem right now, and biases regarding mental health is also like a really important problem right now, because a lot of young people, especially young men, boys, they are scared to go to psychologists to seek out for help that they need, because they can be viewed as weak, as like not manly enough. This is the problem that we face a lot, and it is really seen from the perspective of high schooler who like communicate with other high schoolers a lot. And to address this issue, a lot of initiatives in Ukraine was created, such as How Are You initiative by Olena Zelenska, the First Lady of Ukraine. This is like a really powerful initiative that brings global partnership together to help Ukrainians face the war and face the challenges of the war. Also, we have a lot of others mental health supporting organization and initiatives, such as Christian Chat Ukraine. This is like an online chat to talk with psychologists for free for a fixed amount of time. And Porridge initiative, it's also with meetings with psychologists to address mental health issues for those who are directly affected by war. And of course, in Teenager, we do a lot of mental health support projects also, such as we host regularly mental health awareness workshops to help young people understand their mental health. So, and I myself also hosted multiple workshops on mental health awareness.
It's good that you mentioned mental health, because that has become very increasingly important. And I also do know that in the upcoming UN General Assembly meeting, one of the high-level meetings this year is going to put the spotlight on NCDs and mental health and well-being. But I want to ask you, before I come to Jullian to share her own experience, Viktoriia, how are young people receiving the support, for example, with what Teenagizer is doing and the workshop that you talked about? What was the feedback from young people, and how did they appreciate or maybe concerns they had about the program?
The feedback was quite good. Students were really, they were open to this information. From my experience, they were really open for this information. Of course, when we talked about sexual health awareness, they were kind of like awkward, I'd say,
Yes.
because it is
conversation around
it is
sexual health is always awkward.
Yeah.
Despite the situation right now, knowing that fully well that they can't meet in person mostly, are there opportunities for like support groups, even if it's online, for young people around the issue of mental health?
There are a lot of online opportunities for mental health awareness and mental health support in Ukraine right now.
Thank you, Viktoriia, for young people by young people. Every time I hear that, there's a part of me that just goes, yes, that's how it should be. Okay, let's come to you, Jullian. What are the barriers in the Philippines or in your community that young people face?
So I can't think of any specific that the youth experiences in our country, but I believe that the general answer for this is or would be the financial problems that most of the families of the Filipino people face. So let's admit that healthcare is expensive.
It is.
Is indeed a luxury. So it costs a lot to seek care in hospitals or rural health units. So most Filipinos do not have the budget to spend on seeking healthcare because the money that they earn is not really sufficient enough. So they instead spend the money on something more important. So, for an example, food for survival. So to resolve this, our organization or youth organizations work together to provide budget friendly and accessible service for all. So not only the youth. So we go to communities with our medical supplies and provide them the services that they need. For an example, medical checkups or giving away free vitamins for babies, for mothers, free HIV screenings, and more. So in this way, they won't have to worry about the budget for seeking healthcare, and at the same time, it's within the comfort of their community. They don't have to travel that far. So moreover, we also have participation and a voice in some of the policy reforms here in the Philippines, which is actually a good thing because we experience these hardships on the ground. So we get to hear the stories from our fellow youth and we deliver them to the policymakers. However, sometimes it's kind of difficult because at times they intend to pretend not to hear our voices, but our fight doesn't stop there. We continue to represent the people and voice out their concerns for the betterment of the welfare and well-being of every Filipino people.
Yeah. Thank you, Jullian. So I want to unpack a little bit what you just shared because it's sad that health is expensive. And most families on the ground have to, a lot of times, make the trade-off between either going to the hospital or having the next meal. And that also has impact on young people's health too. And that's why I'm hoping that even as the world discusses the issue of health financing, or as regions and countries talk about health financing, health insurance, we can really work together to see that health is not a luxury, that whoever it is, wherever they are, should be able to have access to healthcare, access to services, in a way that does not have to make families make the difficult choice of, do we need to eat or do we need to buy life-saving medication? So I want you to talk a bit more about, you talked about it in your opening and you mentioned it here again, the program that you are part of.
So actually, I am a volunteer of the Family Planning Organization of the Philippines, and and also at the same time, the Girls Act Philippines. So in both of those organizations, we provide free medical services to all people. So we go to their communities, as I have mentioned earlier.
Mm.
We go to their communities and then we provide them what they need, like for an example, medicines, contraceptives, and other many services that they need. And also we provide care for the mother and child. Like for an example, daily checkups for pregnant women. We give daily vitamins for their babies and such. And for the Girls Act program, we provide menstrual napkins, free menstrual napkins for girls in communities, most especially those the marginalized sectors, because most of the time they don't have access to these kinds of products, so they use other alternatives that are not safe.
Mm.
So we give them the chance to have access to these products that are safe and proven to be safe.
Okay,
Yeah.
thank you very much. And for the benefit of our listeners, the Girls Act program is actually the AIDS Healthcare Foundation's flagship program for young women and girls to empower them to live healthier lives by addressing a number of the social and economic determinants that impact access to health and the dignity of young women and girls. Thank you very much to you and Viktoriia for the amazing work you're doing on the ground with young people to see that they have access to health and to address the barriers that they face every day. So let's go into the discussion of sexual health. The conversation of sexual health is always very awkward, and it shouldn't be, right? I think part of the reason is because every time we talk about sexual health, people only think about sex, especially when it comes to young people. But there's so much more to sexual health than just sex. And we're talking even in terms of education, opportunities to prevention, tools and knowledge and information. So I want us to talk about the specific challenges when it comes to sexual health in your setting.
Education is one of the most important problems that we have as for right now, because education is, in my opinion, I study in a public school, so
Mm-hmm.
I received the public, like the state initiatives first, and from my experience, there is not enough time dedicated to sexual health awareness. There's really not enough time. Maybe we had I remember only one workshop hosted by like a private organization in my school regarding menstrual health. I'm sorry, and really little information about sexual health. So therefore, we have a problem of HIV biases and stigmatization surrounding HIV disease and testing, because there is a really impressive in a bad way statistic that I read that in 2024, according to UNDP, 26% of young people indicate that for them it is unacceptable to live next to people with HIV. This is a really eye-opening statistics, because this is all caused because of not enough knowledge, and therefore there is this pressing issue regarding knowledge about HIV and knowledge about HIV positive people, and also regarding testing. Because I think we have free HIV testing in Ukraine, but I think people just don't know about it or are too scared to go and to test, because according to UNICEF in 2019, which is an old data, but I couldn't find anything newer. So in 2019, according to UNICEF, only 3% of young men do HIV testing. And only 5% of young women also did HIV testing regularly. So only 5% of total young people population did HIV testing regularly. And I think the situation right now is approximately the same or a little bit better. But according to Ministry of Health of Ukraine, actually the sexually transmitted diseases are less spread than in 2018. So there is, at one side, there is biases regarding HIV positive people and biases regarding like the sexual education. And on the other hand, there is also a positive statistic regarding sexually transmitted diseases among young people.
Thank you for highlighting those statistics, Viktoriia, because yes, it's true that even among young people, we're seeing an increase in sexually transmitted infections. So that means that there is a gap in knowledge, but there's also a gap to services that young people can access to protect their sexual health. And that's why the conversation around sexual health shouldn't be held in hushed tones. It shouldn't be under the table. STIs are on a rise globally and across different age groups, across different demographics. And we need to be comfortable with having the conversation around sexual health. So I'm glad that you highlight that and also backing it with the statistics that you're saying and the fact that, we need to collectively do something around making sure that sexual health information and services, because the information is important, but the access to the services, where can young people go or where can people in general go to get the services that they need? This information, is it readily available? But also our governments being able to invest in sexual health for young people as a very critical part of HIV response and STI response. For example, I think of what AHF is doing with its wellness centers, which is a way of demystifying sexual health, a way of making it more friendly and non-judgmental, because that's how it should be, to encourage more people to walk in to get tested and also get their loved ones to also get tested. So I like when you talked about testing, because testing is also another important part of sexual health. Free testing, the availability of it, the accessibility of it, that's something that is important. And we need to, I think hearing young people talk about it is also a good way to make the conversation cool, like young people would say. All right, so we're going to go to the next question, but I wanted to hear, Jullian, quickly, do you have any thoughts on sexual health from your own community?
I think we have the same situation with Victoria, that there is a lack of information and education on comprehensive sexuality education and sexual productive health and rights for
Hmm.
the Filipinos. So, because of this, there is stigma surrounding these topics. It is not often talked about. Therefore, the young people do not access the services it offers.
Mm,
But if they do access this without the knowledge, there is quote unquote shame
yeah.
or negative connotations, saying that they are perverted,
Mm,
malicious, and more. But actually, here's the thing, that's a wrong claim. When you access these services for sexual health, it means that you care about your health and you are responsible, right?
mhm,
You care about yourself and you care about the people around you. So, at the same time, if we pay attention to mental health, physical health, why not we also pay attention to sexual health, right? So another point to consider, or another point that I want to talk about, is that the challenge that the young people face,
mm,
most especially in the LGBTQIA plus sector,
mhm,
one of the most pressing issues is
yeah,
discrimination. So they often receive hate and judgment from society
yeah,
simply because of who they are. So in the case here in the Philippines, the HIV cases are very, very rampant. Just recently, news have spread that the cases have increased up to 500%.
mm,
So that's unbelievably high. And sadly, they blame the LGBTQIA plus sector for it, saying that HIV is the illness of the homosexuals,
mm,
which is not really the
yeah,
truth. So with this, people in that sector tend to be hesitant to get tested and seek for sexual reproductive health services. In result, some just leave HIV untreated, and worst case, some just pass away. So to resolve these health barriers, the organizations that I am a member in work hand in hand to provide medical services and give educational discourses to all people. So we go to communities, we go to schools, We go to universities, and there, yeah, we give out free menstrual napkins and free SRH services to all those people. And yeah, I'm very happy that I am part of that advocacy.
Thank you, Julian, and thank you for highlighting the case of, the Philippines in terms of HIV, because that's something that needs urgent, rapid response and collective response to be able to bring down the rates. And no, we can all agree that the spike in HIV infections or STI infections is not attributed to just one group. No, it is because there are gaps in the response. It is because there are either information gaps, access to services, addressing issues of stigma and discrimination. And when you engage people and discuss about stigma, you see that there's still a lot of misconception about, for example, how HIV is transmitted. People still hold on to very old ways of thinking around HIV. But research studies, they're showing us that no, there are multiple ways in which HIV is transmitted. And we need to do more work, which is where also young people and the communities come in very handy in terms of raising awareness at the community level. But it's also getting governments to address the issue from a policy standpoint. So making more favorable policies that allow people to get access to services, right? It's also around the issue of investing, increasing investment to HIV response, STI response, because then we can afford to have more commodities. It's also the issue of training healthcare workers, because some of the bias that are also faced in the facilities. So it's training the healthcare workers to be able to provide a non-judgmental service, which makes it easier for people to go to a facility to seek help. We're still having a lot of people die from AIDS-related causes, and it shouldn't be. We've gone past that. There's a lot of tools now, and there's a lot of information. So I'm really happy that you're both doing such incredible work on the ground to see that more young people have information and information and services around sexual health. So kudos to you both for what you're doing. So let's just talk a bit about rebranding. When we talk about young people, something that always comes to mind is the issue of social media, right? We talk a lot about social media and young people. So I want to ask you, Julia, if you could rebrand global health in the way that we rebrand trends online. We've seen a lot of trends. For example, we listen and we don't judge. I think that should be one of the cardinal points of health in terms of addressing the issue of stigma, is to listen and to not judge and to point people to where they can get the service. So if you could rebrand global health with the way that young people rebrand trends online, how would you make it go viral, or what would you do exactly to make it go viral?
Global health is actually a very technical and heavy word to work with. So, in order for the young people to understand this word, we must engage with with the platform that the young people use. Like for an example, in TikToks, in Instagram Reels, we can do certain memes or pop culture trends. Like for an example, we do certain dances that we can promote um
Mhm,
CSE or anything about sexual reproductive health. And
mhm,
also in order for it to be full with engagement, I think we must highlight the stories of the young people who experience the struggles, and also who wants to highlight the importance of the CSE and the SRHR. So, most especially from the marginalized communities, such as the LGBTQIA plus youth.
mm,
So, their stories deserve to be heard and shared. So, in doing this, it's not just for entertainment, but we do this to raise awareness. We do this to shift the conversation that is important to talk about these kinds of stuff.
I like when you say global health is so technical. It's this big technical giant, but it's the need to humanize it. So I like that you talk about the issue of stories. Viktoriia, do you have any trend ideas that you can lend the global health community, if you could?
I really was like inspired by the idea of we listen, we don't judge, because it is like a perfect trend to implement like sexual health awareness. But in Teenager, we also like use all of those trends and like ways to engage with young people. I think like a lot of trends are suitable for like engaging with young people and talking about mental health, sexual health. Especially like I saw trends like my do and don'ts in like fashion, and we can adopt that to sexual health. So like don'ts, like I don't know, don't put condoms in your wallets or like anything like this. So there's actually like always a way to adapt trends to the topic that we want to talk about. It's like requires a little bit of creativity.
Great. Thank you so much. Yes, it does require creativity because we need to make it more creative in terms of how health is also discussed, especially for young people and for young people. And young people are usually the powerhouses of creativity. That's where you find a lot of creative ideas and vision on how we can make health even more relatable, but also make it more accessible. So thank you to the two of you. So let's go now to, we've talked a lot about governments, right? We've said that the government needs to do certain things, even to support young people's health. And I wanted to ask the both of you, so maybe we could start with you, Viktoriia. If you had 1 minute with world leaders, with world leaders, what would you tell them about the future young people want in global health? Like we always say, what do young people want?
I would say that we want equal access to healthcare for all people without regard of their gender or any other like identification, and some more time in schools dedicated to mental and sexual health awareness, and spread of the information to make the conversation about healthcare less biased, and really to spread awareness and to make the health topic the main topic of the day and of the every in each day we have, because health is of course important, especially for young people.
Thank you. Jullian, if you had 1 minute.
Similar with Viktoriia, I would want to highlight the accessible medical services and anything that involves healthcare to all people. I want them to have access to all these kinds of stuff because this is not just a need, but it is our right to have this access. I also want to give importance to um, sparking conversations about eliminating discrimination against the LGBTQIA plus, because I think in our society they are the most vulnerable to all of the hate. So I would want that the leaders would emphasize
Mm,
to not hate these people because they just want to
mm.
express themselves.
Very strong words there for our leaders on what they should take into account. And it's good that this episode is coming at a time where the world is getting ready for the G20, which is currently being chaired by South Africa. So this is a good time to get this out there to world leaders on what young people really want. All right, we know that when young people are having conversations, there are also other young people who are listening. And it's been so refreshing to hear the both of you share your story, your journey, and the work you continue to do regardless of the circumstances. And I'm sure there are a couple of young people who would want to get a word from you, for them. Maybe young people who may be facing hardships at this point in time, or even young people who aspire to become voices for their own peers. What would be your message to them today? Let me start with you, Jullian.
So, to every young person out there who is facing hardship, I want you to know and I want to highlight that you're not alone. I say that not just as someone speaking to you today, but as someone who's lived through it. So, when I first started my journey in youth advocacy, I was shy, I was quiet, I was introverted. So, I joined my first organization not because I had everything figured out, but because I was searching for my purpose, for confidence, for belonging. I didn't know what to do or where I fit in. I was just really testing the waters that time. But as time went by, things began to shift. So through every seminars, through every journey that I've been through, I started to find my voice. So I became motivated, not just by what I was learning, but by the people I met, especially those from the marginalized communities, who reminded me why this work matters. So their strength also gave me strength. Their hope became my fuel, and that's what I want to pass on to you today. So, whatever struggle you're facing, whether it's discrimination, mental health challenges, or simply trying to find your place in the world, your circumstances do not define your worth. So, you are strong, you are seen, and you are capable of rising above it all. That's
Okay. I had a lot of chills listening to you, so let's go to you, Viktoriia.
My message would be kind of similar to Julian's because I want to emphasize once again that to whoever facing hardships or some kind of like challenging circumstances, you are not alone. You are not alone on this path. You will never be alone as long as you're out in the community. You will always be supported. You will always be heard. And I want to emphasize you are not alone. And to whoever wants to join the advocacy movement, my only message is act. Don't fear, don't be scared of any circumstances or of judgments of other people. Just act. If you see a problem and you know that you can try or you can solve this problem, act and try to solve it. Other people around you, they will be inspired by your impact, by your acting, and they will join you. They will not judge you. You will find community that supports you. You will find opportunities as long as you're willing to act. So to whoever wants to join advocacy movement, just act, and it will make an impact. I promise.
Wow. You are not alone, and just act. Thank you so much, Viktoriia and Jullian. I don't have anything else to add to that. I think they stand in their own power from the two of you. And I hope that young people draw a lot of strength from you both as they go on the journey in global health and making sure that young people's voices not only are heard, but also is able to influence the change that we want to see. Now we are coming to the end of this episode, and we normally have a fun part of it where we ask our guests some really fun questions just so people get to know you beyond your day-to-day work in global and public health. So if you're ready, I'm going to ask each of you a bunch of questions. Don't think too hard about it. It's nothing too serious. Just some really fun things. And please feel free to answer the question as you would like. So if you are ready, I am ready. Are you ready? And just so you know, I'm not asking you the same questions. So I'm going to ask you different questions. So I'll go in alphabetical order. So I'll start with Jullian and then I come to Viktoriia. Are we ready? Great. All right. So let's start with you, Jullian. If you could have one superpower to improve health, what will it be?
oh, oh my gosh, this is a surprise question for me.
That's the essence.
I Yeah. I think the superpower would be the superpower of flying so that I can deliver the services to all people, whether they are in the mountains or in the desert, whatsoever. So yeah, flying would do.
Sounds like you want to be a drone. But that's good. That's I like that. The superpower to fly and deliver services to everyone because everybody
Yes.
should have access to services and medication regardless of where they are. Great. Viktoriia, what song makes you feel powerful?
Oh, that's also a surprising question because I listen to a lot of songs. But I feel that I really like the song Bayana by Barbatukis, if I pronounce their name correctly. And like, this is a really powerful, like, kind of indigenous vibe song from like Latin America. I think I'm
Mm.
not sure. I'm sorry if I state the information wrong, but it's really empowering because of a lot of people participate in this song. And when you listen to it, it gives you power to go to the community and to act, to communicate. And I really love this song.
Nice. And then, Julian, what's your favorite food?
My favorite food is, of course, adobo. It's a Filipino delicacy. It's the taste is savory. It's made with soy sauce and vinegar, and it
Hmm.
comes with a chicken, pork, or anything that you like. So yeah, adobo is so good. You should try it.
I would look out for it. Sounds yummy. Okay, Viktoriia, if you could spend a day with any global, or if you could spend a day as a global health leader, who would it be?
Oh, that's a really interesting question. But I would really want to spend time as our like kind of health leader in Ukraine as Elena Zelenska, because she's like the founder of How Are You initiative,
Mm-hmm.
and I would really like to live my life as her and to
Mm.
like see the background of everything that she does.
Oh wow! I hope she sees how she's inspiring you. That's great. Julian, name two people who inspire you and why.
Okay. So the first would be my mom,
Mm-hmm.
and the second would be my grandmother. So my mom is actually a barangay counselor. So she's in public service. So she interacts with many people here in our community.
Mm-hmm.
So she helps a lot of people. So yeah, she's actually my inspiration to do public work
Mm-hmm.
and public service.
Nice.
And then for my grandmother, she was the one who took care of me ever since I was a baby. And she taught me a lot of good values, morals in life
Mm-hmm.
that I will forever live by. And yeah,
Great.
those two women inspired me.
Yeah, that's great to hear. Okay, so Viktoriia, what nickname do your friends or family call you?
Oh, actually, a lot of friends and like family, they call me the short form of my name, Vika, which I don't really like. I really like my long name, but um, like a lot of people call me like um, I'd say I have heterochromia,
Mm-hmm.
and a lot of people like notice that and they
Mm.
highlight this.
Mm.
And also my surname, it's like I don't like I'm brainstorming different answers, so it's kind of
No,
random.
but
I
Vika
don't,
is fine. Vika is okay.
okay, yeah, but I
No, it's
also have
okay.
like a kind of nickname
Mm-hmm.
that's connected to my surname. It's like
Okay.
Wonder. I think it is translated to English as Wonder, because
Okay.
my surname is Chudovska and Chudo is Wonder. So a lot of people they make this connection. So yeah,
Oh, so Wonder like Wonder Woman, Wonder Man,
yeah,
Wonder
yeah, something like
anything.
that.
Oh,
Yeah.
great. Okay. And the last question to you, this would be to Julian. What social media app can't you live without? Or what's one social media app you cannot live without?
Oh my gosh, that's hard. I guess it's TikTok because the videos there are funny, it's engaging, and I get to send funny TikToks to my friends. Yeah, TikTok it is.
TikTok it is. Thank you both so much. And to our listeners, today's conversation has made one thing clear. Young people are not waiting on the sidelines. They are already leading, innovating, and driving change in global health. The challenge now is for governments, donors, and institutions to listen, invest, and act alongside them to truly support youth leadership. Because the future of global health isn't coming tomorrow. It is already here, as you can see with Viktoriia and Jullian, and it is hopeful and powerful. In our next episode, we will turn the mic to Africa and Latin America. Until then, stay connected to your youthful side and keep listening and taking action. Thank you once again. I'm Kemi Gbadamosi.
Thanks for being part of the global public health revolution. We hope today's conversation left you inspired, challenged, and ready to shake things up. If you loved this episode, don't keep it to yourself. Subscribe, leave us a review, and share it with your network. Let's keep the momentum going.